Hi, y'all. I'm Jody with Our Broken Systems. I am here today to discuss some issues with IDOC, which is Illinois Department of Corrections. The main focus of this video today is we're going to discuss mental health uh, on the inside and on the outside for these guys and gals inside of IDOC. Generally, we talk about bills and trying to get stuff passed. Well, obviously, that's not going anywhere at the moment uh, due to the issues with the president and our governor and everything else that's happening. So, in the process, I figured we could try to help these men and women that are on the inside get some mental health and get some medical care that they desperately need. Onto the contrary of what a lot of people think, they are still human and we definitely need them to have it. It is important that they get this and that we as constituents and society understand that concept. I understand this is an educational, first off. Second off, we're not going to race bait. Third off, we are not going to downplay any victims or their feelings on any of this. This is solely our opinion unless we have facts to back it up. And right now, like I said, we are going to discuss mental health and health issues inside of the Department of Corrections and the drug addictions that is going on. We have had a lot of exposure media-wise on this. That has been negative all the way around about the drugs coming in through the mail and so forth and so on. We're going to discuss that also. But right now, the main concern is mental health. We look at it like this. The state is willing to spend $900 million to rebuild a prison that's going to be a 1,500 unit bed, which is supposed to be state of the art. I think personally that's a ridiculous amount of money for one prison, or even two for that matter. We have over 10,000 men and women inside of IDOC right now that are worthy of a second chance and able to have parole and are being denied it. Hi, Brenda. Thanks for joining. And it's like this. These guys could use that money to put the prisons together, revamp them, and put programs in that need to be for the mental health assessments. That's all there is to it. Anything you want to elaborate on that, Brenda?
Just that I feel that there's more that needs to be done for those that are suffering from mental health
And
who
your
don't
thoughts on it?
who don't have an outlet behind the bars for the most part.
She has data that can back up a lot of this. The reason that we're doing it is because there are guys and gals that are suffering horribly, excuse me, due to the lack of mental health. A lot of them don't have family they could talk to or enough doctors in the system itself to talk. It is a shame because when they do want to talk to a mental health provider, their HIPAA law is being violated when the staff talks to other officers or other inmates about what the guys are saying. We can't prove that 100%. That's hearsay. But it's like this. When you got multiple families that are saying the same thing to each other on the street, and you've got multiple guys that are saying it to family, somewhere along the line, somebody's got to be telling the truth. What that is for us to find out. It's a shame that they still don't feel comfortable to talk to us about it or to mental health about it. We need to come together and figure out how to do this. And what do you think? What do you think on this?
I just feel like if more is being done than what we know about, it really needs to become transparent. Without transparency, what are the family and the constituents supposed to think? Because we hear from the individuals in there about it, but how do we know, that they are getting it? Where's the transparency? And there's a lot of questions that a lot of us have, and they go unanswered.
We there is an article that was brought up right here and whatnot, and it is the Healthy Minds, Lives, and Coalition support HB 1085 HCA1 pass House 72 to 33. And this is improved network accuracy and access for the behavioral health. Inadequate insurance network for mental health. Significant numbers of mental health and substance use clinics leave chemical insurance or commercial insurance networks due to inadequate reimbursement and unnecessary hurdles to care. That is another issue with our state, any state for that matter, especially ours. They're not getting paid enough. They're not getting paid on time. There's not enough healthcare workers to go around, nor to be trained to step inside of IDOC, and a lot of them are scared due to security issues. Well, we need to combat that. These guys and gals desperately need help. Limited or meaningless patient coverage. Patients are forced to go out of network, pay out of pocket for behavioral health, and the insurers have increased reimbursement for other privileges for short supply. Some of these incarcerated men and women, from time to time, they have to pay to see health care. It needs to cease. And then when they do get an opportunity to see the doctors, they are forced to wait weeks or months for follow-ups, especially on some major issues from someone having a stroke or heart issues or cancers. They get seen, but then it might take them a year to get seen again for a follow-up. How is that fair? Like they got a broken shoulder or a wrist and they have to have surgery. It takes weeks and weeks for them to get seen in the first place. Then when they do get seen, it takes another 6 months to a year to get them out to get it fixed. If that was you or I out here, we'd be right on it like this and get the care we need. Well, they're no different. I've always said the judge sentenced them to do their time. That did not mean for them to be abused even more. than what it is. And to everyone, you guys always got this theory, if you can't do the time, don't do the crime. Please stop saying that, because everybody is capable of committing a crime or being part of a crime. We are advocating for them because they're still human beings. Unto the contrary of what they've done or have not done, they're doing their time like the judge said. So therefore, we as constituents in society need to make sure that they are at least treated like human beings. We are not third world country. And we all need to understand that. Because eventually these people are going to come back out into our society unto what everybody thinks they're coming out. And we want them to be mentally prepared to come back out here so we as a community could be safe. They could be safe and be productive citizens when they do come out. Instead of pop shotting at them and, not wanting to help them, let's all come together and come up with a plan that's going to benefit them and us. Because I don't know about the rest of y'all, but I don't want to spend the rest of my taxes, the rest of my life supporting IDOC when they can also get out and help support themselves and their family.
We can't make it sound like they're sending out.
They're not going to be sending out. My girl here, Brenda, there you go. Explain what you were talking about.
Okay. What I'm saying is just about everyone has some type of depression in their life that they need to deal with. And the sooner that people admit that they need help, they should be able to get it. They should be able to have someone licensed that can work with them on this. And by doing so, it makes the communities safer. And that goes for anyone who is in confinement. They deserve it as well.
The Norwegians had a right idea when they came out with their system to redo it and to make everything pretty good over there. They learned to reduce a lot of different stress levels over there with their correctional officers and the inmates, incarcerated as we call them here. Actually, now we call them residents, believe it or not. We've changed that name 1,500 times too. So it's kind of hard to keep up with the terminology that we're technically supposed to use. And they want to know why the men in there and the women in there have multiple issues with bouts of depression. It's like this. Imagine you sitting in a room that is 6 by 6 with one small window that not even a 5-inch fan, if you have a window, can sit in, and no bars, just a solid door on some of them, by yourself, and day in and day out, and only allowed out 1, maybe 2 hours a day. And some days they're on lockdown 24/7. And you do that for 3 or 4 or 5 days at a time. That's no movement, no phone calls, no visits, no video visits. Very rarely do you get your mail on time or get your mail sent out on time. How do you think you're going to feel? What are you going to feel? Be totally cut off from the outside world, other than seeing a correctional officer who is supposed to come by every 15, 20 minutes to check on you. And some, from what I heard, don't do that but once an hour. So therefore, who do you got to talk to other than four walls? And if you're already struggling with depression before you went in, or drug addiction or combination, and you're going through this, what do they think your psyche is going to be like even more? It's going to be even worse. So therefore, we need to get counseling in there, some way, shape, or form. Peer to peer, if we have to, someone that these men or women can trust to open up and to talk to about the everyday struggles of what goes on inside there, and that they know that when they talk, their story is not going to be put out there, and officers are not going to spread it from person to person or other people or make fun of them or retaliate against them. That's another issue why these guys do not want to talk. And that is no secret. That is a common fact and knowledge amongst everybody inside and on the outside. That's been on like that for years. So this ain't something new, something just started, but we do need to combat it, because I look at it like this. Everybody's got a breaking point. It don't matter who you are or where you're at. You could be out here, you could be in there. Either way, you can have a breaking point. And when you get to that point, then what? It is a shame that when our loved ones get hurt in there or hurting in there, we do not find out about it for days, sometimes weeks, sometimes not at all. And that needs to cease. We as family should be the first ones called to be told if our loved one has been taken out of there due to mental illness, an illness period, or if they've gotten hurt. We need to know that. We understand it's a security risk, but you ain't got to explain where they're at what hospital or facility, but at least let us know that they're not in the facility anymore and why. That takes a lot of stress off, not only on us, but off them too, because they stress because they're hurting and they're not in there and they have no way to get a hold of us to let us know that it's wrong on every level.
You got 3 minutes left.
And whatnot. Well, I have got just a couple minutes left on this. This discussion is not even over with. I'm going to do another video here in a little while. We're going to talk about this some more, and I'm going to bring up some data while I'm at it. So thank you for listening, and please join in again with any questions. If you have any, PM Brenda or me, and we'll try to find the answers and give you the answers on live. Thanks again, you guys, from Our Broken Systems.
Yeah.